I've been feeling so down, yeah. Can you tell me why? Can you tell me why I'm down, yeah. No friends of mine around, yeah. Now I'm thinking I might have caught the June blues. Yeah, I wanna drown myself inside the juice. Yeah, you know I keep on running from the truth. Was that not? I'm just a lonely fucking you. Now when I travel.
Hello. It's the night before surgery. Today I had like this huge hiccup issue with my surgery date. 2 weeks ago I noticed that there was something really weird about the way that the surgery was scheduled. It showed that I was actually having 2 surgeries on one day, and that didn't make any sense. It showed that I was getting the thyroid surgery and also the tail gut surgery at the same time, which I never authorized. I called them and they never made any changes. And since today was the day before our surgery, I called the office and I said that is so wrong. So the nurse on the phone said they were gonna take care of it and cancel it. And around 4 o'clock, I haven't heard anything. So I call back and it turns out that she canceled my surgery because since it was a joint order, by canceling that one, ended up canceling my thyroid surgery. And I didn't know that. So that got me panicking and I was like, you canceled the surgery that I'm signed up for tomorrow, and you need to get me back on the list. And at that time, it was already 4:30 and I was in the middle of a work call and I was like, dude, I don't have time for this. At 5 o'clock, I started calling back and I didn't realize at 5 o'clock, all of the hospital departments start putting up their answering machines. They're like, yeah, we're not here now, so you can call back tomorrow at 9 a.m. That freaked me out and I called so many people to try to reach to a human being. And yeah, that got my heart pumping. I was really pissed off. And finally, they were able to fix it. And for some odd reason, they said that they were communicating and they were on the same page about doing the surgery together, which made no sense because my doctor actually told me he was not for it. So it made no sense to me why he would agree. That's definitely something that I'm going to ask him tomorrow, like what happened there. So I guess that ended up getting fixed and I got my information around 6. So the protocol today is no food after midnight and about maximum 12 ounces of water before 11 a.m. and show up to pre-op surgery at 1:30. Surgery will start at 3, ranging to 7:30. And then the post-op is after 7:30 onwards. And depending on how well I do post-op, the earliest I would be going home is like 11 p.m. If they decide to like keep me after, they'll have to like transfer me to a different part of the hospital with the beds. And unfortunately, due to COVID, there won't be any visitors or any waiting room guests. So it looks like I'll just be picked up afterwards. And I am a little sad that I have to do this alone. But, you've got any choices. So thank you so much for everyone that like messaged me and checked in today. I'll be thinking of you during my post-operation and hopefully I can go home and not have to stay the night. Surgery day. Surprisingly, I am not feeling nervous yet. I feel like a new day, so hopefully this feeling keeps going. And yeah, I'm shocked that I'm not nervous right now. We'll see. There's a delay and I've got to wait. It's 3 o'clock now, so I've got one more patient ahead of me, so it's possible I might need to stay overnight. Right now I'm feeling fine, kind of thirsty and hungry, but I'm still banned from food in general. Look at my hot look. So ugly. So ugly. Hey friends, I'm back from the surgery and it's 3 a.m. right now. I want to make a video so you can hear what my voice sounds like after surgery. So I arrived at the hospital and there was a big delay because of a patient going over time, and so I started late. I was kind of in the waiting room with this pretty hot outfit, the lunch lady outfit, and I was really bored and I didn't want to talk to anyone at that moment. I was kind of in the zone of being calm, and I watched a lot of TikTok and I found this filter here that changes your ugly socks into Cinderella shoes. I thought that was really funny. It's like, tell me when you're bored without telling me you're bored. Yeah, so my surgery was scheduled to start at 3. I was there at 1 and didn't start happening till 5 to 7 o'clock when I was finished with the surgery. And they put my IV on my left hand and they were planning to do the robot on the right. So the doctor came in, marked me up, drew like a marker path with the marker. So I got surgery like right under my armpit, like here, I think. I obviously can't see what it looks like now, but this whole area here, like below my like chest area, was the whole thing. And right now they basically made this compression like bandage that's like almost like a bra, like goes all the way down to the bottom of my boobs, and it's covering like this. It's kind of like a sling but going diagonal, and the purpose is to compress so the swelling and of my skin is going to be controlled and down, because right now I can tell there is some like, you know, swelling and puffiness. They're trying to like decrease. I'll have to be wearing this for about 2 weeks, and they suggested I buy like a compression bra / shirt from like Lululemon or Peloton and look into something that's really tight. Like right now this is like very, very tight. So yeah, that's the most important part of my recovery, is this, and also keeping up with the medication, the pain meds, currently I'm not on any thyroid hormones yet. The surgery time came. Someone came and was like, we're ready for you. Anesthesiologist, and them did their questions and checks. And unfortunately, I did see everything in the operating room. It freaked me out when I first saw it. There was just so much going on. You know, what stood out to me was like the walls were like beige tiles. Of course, the designer in me is like, what the hell? But anyway, it was like kind of like a big bathroom. Like, it was not big enough for two robots and two people, but it was big, very big for one person. And around the walls were like stainless steel cabinets filled with all kinds of stuff, like containers, labels, instruments, and there were like about 6 or 8 people in the room. I couldn't really tell because it was so overwhelming at the time, and everyone was really busy. They had their own station and like messing with their own, like preparing and messing with their own things. And, you know, no one really was talking to me. My surgeon was there, and they're like, you know, just have a seat here. And the seat was in the middle of the room. It's this long, thin, metallic table with a sponge to hold your head. And then there was like 2 metal pieces attached for your arms, like kind of like a Jesus pose. So my IV was on the left, so my arm was out, and then the robot incision was on the other arm, so I think I was put in this like a Jesus pose, I suppose. And while laying there, you know, I had my contacts on, and they're like, you need to remove it, so I'm kind of blind. After that, I'm stealing at the ceiling, and there's just like 3 large lights with tons of LEDs in it. It just felt like, you know, alien abduction, and when it's kind of like mildly bright in the room too. It was not dark, and all I saw was just like people's faces and top of their eyes with their mask on. So just kind of a strange look, right? So what was happy was that they did not count down for me. They just said, okay, we're gonna attach the IV to the fluid and, you know, just breathe through this oxygen mask. I don't think it even took a second because I didn't know anything. The next thing I did, I woke up in the recovery room. I'm kind of happy they didn't count because I think the count would have made me even more nervous. Just like how I really appreciated this time when they put in the IV needle, that they didn't count. They just did it, and then, you know, I like that. So, and then once I woke up in the recovery room, that was the movie Get Out moment. I heard the nurse call James and tell him about how things went and how I'm sleeping. And it's only been 20 minutes since I've been wheeled out. And inside I was like about to respond, like, I'm not sleeping, I'm awake. And that's when I realized I couldn't talk. For 2 reasons. 1, my throat hurted so bad I couldn't talk. And 2, I was so like loopy. And originally, I was very nervous about feeling nauseous because that's one of the top symptoms after general anesthesia. I did get an anti-nausea patch right under here, and I know they put anti-nausea medication in the IV. But, you know, for some reason, I didn't get nauseous at all. But I had the opposite thing. I felt very loopy. And the way to describe loopy is like, you know, if you took like 5 Patron shots, okay, like all at once, and you're just like, let me make it to the bathroom without throwing up. That's how I felt. Like, I'm sure some of you guys have that feeling. Like, I don't know, maybe I'm really good at like controlling nausea, but That's how it feels. But by the way, the room doesn't spin, so that's like, your trone's a lot worse. So I realized that I couldn't talk because my throat hurt so bad. So the nurse was really attentive. I tried to get her attention, but I couldn't really speak. I was just very weak and like still kind of in and out. Like I couldn't really open my eyes very much. Like I was just like fighting my eyes like from opening. It was a lot of that. And I did not feel sleepy. So it was not a sleepy sensation. It's just more like you were sedated type of feeling. So I was just trying to like, you know, get my eyes open more and more longer periods of time, but it feels like only a second or two that my eyes were able to be open. And so she comes over, she's like, hey, how's your pain level? And out of 10, you know, 6 to 10 is like, you know, my arm's falling off, it hurts really bad, or you know, knowing that you will have pain and is not expected to not have pain. That was the expectation. So I couldn't really talk much, and I only said like 2 words. I said like very painful. So she brought over a cup of water with a straw, and she's like, can you try to try to drink this? So I took a tiny bit of a sip, and boy, it hurt so bad. I couldn't really swallow it. It was like the muscles for swallowing was weird, and I was like, wow, that hurts really bad. So I told her that I got some cough drops in my purse. Can you get that to me? So I saw this on other people's YouTube accounts, and this was their recommendation. And I'm going to tell you, this was like the best thing ever. I feel like it helped me so much. So I know there's like, you know, Ricola and stuff, but like other things that don't taste so medicinal. This is all organic, and it does not taste like cherry medicine or whatever. So I got this from recommendation, and I highly recommend this. So she gave me one of these, and I felt like my sore throat went down by like 50%. It got better enough that I could sip the water. Yes, the first few times the water hurt so badly, but the longer I had the cough drop in that numbed my throat, and being able to hydrate my throat as well was just like improved by the hour. And that's due to like the breathing tube that they shove down your throat when you're out. So as soon as I was able to drink water, like little bits, she gave me oxycodone in the pill format. And I asked her, what's the difference between this and like through the IV? So she said to me the IV is quick action because it was right in your bloodstream, but it doesn't last. And the pill takes about 45 minutes to start working. So better to just start taking it now. So I was like, how big is this pill? Because like I could barely just drink a tiny bit of water. Luckily, the pill was super small, like super small. And she was telling me like, you know, they're conscious about like the opioid crisis and addiction, so they're going to just give me that, and hopefully that will work. So after 45 minutes, she came back and asked me again to rate my pain level for about 2 or 3 times, and the pain level has definitely went from like originally like maybe an 8 or a 9 to like a 6 and then down to a 5. So like it progressively got better over each 45-minute check-in. So I'm really grateful that the nurse was so attentive and came over and asked like, how is it going? I was well enough to drink like a small cup of water. That also helped a lot. And then at that time, it was almost 10 p.m. and the recovery room was going to close. So they transferred me to the main recovery room on the 3rd floor. And in there, it was just like so chaotic tonight. there was a lot of people with emergency situations that came in, so it was really hard to sleep in there. But you know, it was fine. So after being there, I was there for at least 6 hours, which was the bare minimum that you're required to stay, because they need to monitor you and make sure that you're okay. So my checkout time was 1 a.m. in the morning. So at there, I asked for more painkillers near the end of like 1 a.m. and she was able to give me some through the IV for the road, and then pick up the painkiller, which is the codeine. So they're going to give me codeine for like 3 days, and then later I can take Tylenol to like progressively step down from the pain. They're very conscious about how much they give you, so I appreciate that. 2 hours in, I decided like I was confident enough to use the restroom, and so the nurse assigned someone to go with me. And the second like I got up to go, it just felt like you're the drunk person trying to go to the bathroom at like a club or something. That's how I felt. It was kind of wobbly and loopy and kind of strange. And moving my arms at that time, I could really feel it afterwards, like, oh, something happened there. So yeah, the surgery was a success. They took out half the thyroid only, and they're going to test that in pathology. Going forward, it's just a pain medication for now. And if any symptoms come up and I need hormone replacement therapy, then we'll see what happens in a 2-week checkup. So that's it for surgery day. And I think every hour I'm getting better, because right now it's 3 p.m. and I'm able to like make this vlog. In the beginning, like I couldn't talk for more than like a few minutes. But my voice is very weak, like I cannot speak loudly, and it does get really tired and sore. So I think everything went well, and I'm happy with the outcome. By the way, thank you everybody who's supported me on the way to the hospital. My head had like a running memory of everyone that's sent me gifts, spent time with me on FaceTime, and the day before asking me and giving me positivity, and even today, the day of, giving me strength that I could do this alone. And as you know, this is COVID, so I had to do the whole surgery on my own in the recovery area as well, and James was able to pick me up outside when it's all done. So I want you guys to know how much I appreciate all of the positive words. It really helped me a lot to have faith and continued positivity going forward. So thank you so much.